I remember her saying the words malignant, but I was like, I don't even know what that means. Like your cancer lexicon isn't that. When you're not a cancer patient or it really hasn't touched you in some shape or form, you don't really understand this medical lexicon and this vernacular. And I remember her saying malignant, and I'd be like, what is that? And then she said the word cancer. I had a needle-like sensation on the bottom of my left foot. So it was almost like my foot was falling asleep frequently. And I just couldn't stretch my quad because I felt like there was this pain behind my knee, but I wasn't able to really pinpoint like exactly where it was coming from. And it was reoccurring for around a year or so, but I went to multiple doctors, but I couldn't really pinpoint exactly what was going on. I went to multiple physical therapists and no one could really pinpoint exactly what I was experiencing. And they were like, it could be a pinched nerve. You could just be, sitting down too much. You might want to look into a standing desk, that kind of a thing, but nothing really concrete or definitive. I would say the most pain was when I tried to stretch my quad. So after a spin class, I did spin very often. That was one of the main reasons I was able to pinpoint that I couldn't actually stretch my quad properly. That was probably when it was the most painful. But other than that, it was really like more of an annoyance than a pain. So I remember really vividly, I was sitting on my bed and I was stretching after a spin class, and I was putting my hands under both of my knees, and I, for some reason, like squeezed or pressed my left behind my left knee, and a shooting pain went down my leg from my kneecap down to the middle of the bottom of my left foot. And I was like, oh, there's something there. And I kind of noticed that there was a tumor or something there. And I was like, it's probably just a cyst, but that definitely motivated me to get a doctor's appointment penciled in swiftly. It was a physical that I actually already had scheduled, but I ended up moving up, and she said it was most likely a benign nerval tumor or a cyst like I thought, but let's just get an MRI to triple check. And so that's what I did. I moved forward with the scan. So an MRI is about sometimes it's a 30 minutes, sometimes it can be up to an hour or more depending on the body part, but you essentially sit in this space-like machine and it makes a ton of noise, and you're either wearing a pair of headphones and listening to music or just have earplugs in, and you kind of just sit there. And my first scan that was my first MRI, I believe, that actually I ever had. And I remember being like, what is this thing? And I wasn't stressed. I was fairly calm actually. But it's kind of more annoying. You just can't move for an hour. And I think for me, the most stressful part of a scan is waiting afterwards, not necessarily during it. So it's funny because I actually don't remember any anxiety at that point, because I was working so much and was moving at such a fast pace that I didn't really think anything of it. And I think a lot of cancer patients can relate to this before they were diagnosed. Everyone thinks that they're Superman or Superwoman and pretty much invincible. So I really didn't have any anxiety, I would say, after that first scan. But today the anxiety is most definitely real and there. And I don't think it ever really goes away. I think you just learn how to manage it a little bit better. And for me, I really hone in on those rituals and routines, typically the more spiritual and wellness oriented, that really helped me stay grounded, calm, and composed. But I mean, I vividly remember when I got the results back and where I was and how that felt when I saw that it was a tumor, but it came back as benign. But just the words tumor freaked me out. I left work instantly. I remember calling the nurse at my primary care and giving her verbal confirmation that she can send me the results. I, to this day, don't even know if that was legal, that she was able for me to for me to look at those results without my doctor, but she sent me my MRI results via email. And then I read them and saw the word tumor, although it was next to the word benign. I still freaked out. I had that like paralyzing moment where I saw like double vision, and I totally was panicked and I left work. I ended up calling my doctor, and she calmed me down and, introduced me to a surgeon and kind of to take next steps. But I mean, I remember going home and just her, again, nonchalant nature and attitude made me feel more at ease. At that point, I wouldn't say I was that tapped into my own sense of self or like listening to my gut. And in retrospect, I feel like I knew something was wrong. I think I was just masking my fear and leaning on other people's opinions and words a little too much. So the first surgeon that I met with was the one that I moved forward with. And he was fairly arrogant and honestly confident and like overly confident, and even told me I could keep the tumor in my leg. Like it really wasn't that big of a deal. It was a benign nerval tumor. And I remember second guessing his energy and my relationship with him and my conversation with him, and going back to my general physician and being like, are you sure you recommend him? Is he like the best of the best? He was an orthopedic surgeon at NYU. And she was like, yes, he comes highly recommended. I personally haven't used him for surgery, but he comes highly recommended from other patients. And that's when I really should have listened to my gut, because I did move forward with that surgeon thinking it was a benign nerval tumor. And lo and behold, we found out it was malignant after the surgery. So my surgery was just to remove the tumor, and the tumor was intertwined within my tibial nerve on my left side. So that is a nerve that kind of, it gives you motor function essentially and sensation on your left leg, on the bottom of your left foot, your calf. And so we were just going in and removing that tumor. And I think overall, again, listening to other people's confidence that it was benign put me at ease. And I'm fairly fearless and trusting, sometimes to a fault. And I would say in that surgery, I was more in that New Yorker attitude where I just wanted to get it done, get the tumor out so I could get back to my day-to-day, get back to my, spin classes and my working out, and just get my life back on track. I was more looking to just like, check the box and move forward. I was in bed rest for maybe a week. But I could really put pressure on it and kind of start walking right away. I had a 3-inch scar behind my left knee, and that is different to where I'm at today. I mean, I could get really emotional talking about it, in all honesty. I mean, it could have changed the entire trajectory of my treatment. So my first surgery, they ended up leaving pieces of the tumor in my leg, thinking it was benign. And so I can't get into the details because I haven't asked my doctors that much, because again, you can't change the past and you don't want to drive yourself insane. But my treatment probably most likely would have been less intensive if we would have taken a more thorough approach when it comes to pre-surgery. Trust your gut. Get multiple opinions. I mean, there's nothing wrong with more information that can help bring more clarity to your own opinion and perspective. But the day I was diagnosed, I remember so vividly. I was sitting in my bed, my leg propped up on a pillow, and I was working. I was working remotely, and I was blogging, and I was writing. I was a partnerships editor at Hearst at the time, and I was writing for 27 different publications. So I was just back at it as like in that New Yorker mentality, you know, just like I was speaking of before. And I remember I was having routine nurse follow-ups. You know, nurses would call you a couple times a day just to like check in how you were feeling, how you were doing, what your pain was, 1 to 10. And I remember my phone ringing and me just picking up completely still in the work zone, not even paying attention and not realizing that it wasn't just a nurse calling me. It was actually my general physician. And I remember stopping what I was doing when she said the words, "Are you sitting down?" And like, I mean, I could still get so emotional. But like after that, I actually don't, speaking of like remembering it vividly, I mean, I don't remember like anything really after that. I like completely blacked out. I remember her saying the words malignant, but I was like, I don't even know what that means. You know, like your cancer lexicon isn't that, when you're not a cancer patient or it really hasn't touched you in some shape or form, you don't really understand this medical lexicon and this vernacular. And I remember her saying malignant and I'd be like, what is that? And then she said the word cancer. And I mean, I just remember tears streaming down my face and my body just red hot and me just like convulsing, honestly, and just like almost dry heaving. I mean, it was a out of body experience. Like I really felt like I was in a complete nightmare and it wasn't real life. And then after that, I kind of I cried and then I went through the motions and I called my loved ones right away. I didn't even take a pause really. But given the cancer was a rare 1 in a million, more rare than 1 in a million soft tissue cancer, it was a circumstance where we had to move very quickly. My PET scan thankfully came back completely clean, other than the area in my left leg where we knew the cancer was, because again, the tumor was out of my leg at that point, but there were still pieces left on the nerve. But he basically took me through, you know, the trajectory of my treatment, and that we needed to move quickly because this was a rare cancer. I started a week later, so it was very quick. I was still trying to juggle my job at the same time. I just didn't know how the chemo was going to interact with my body, so I kind of moved forward with confidence that I was going to be able to juggle both. Spoiler alert, I wasn't able to juggle both. But I personally, first, I want to note that every body is very different and every cancer is very different. But my particular regimen for synovial sarcoma was to be 6 chemo sessions, 3 high dose of ifosfamide and 3 of dioxorubicin, it's also known as the Red Devil, which is like such a horrible name. But 6 chemotherapy treatments that were not inpatient. I was able to go home, but the infusions range, you know, from around 6 hours, I would say. And it depends. I think the ifosfamide was like around 8 or 9 days, and the dioxorubicin was more of like the 3 to 5, depending on where my white blood cell count was and where my overall like blood panel, like how I was doing immunity wise. And that took 4 months to complete. And I actually wasn't able to complete my 6th session just because my body wasn't able to bounce back. I was essentially neutropenic. And then I moved forward with surgery and then 36 rounds of radiation afterwards. And we really firmed up that radiation number though, way like right before I started. So I had 2 weeks off. And I would say that 1 week to 10 days right after my chemotherapy treatment, I was knocked down. I was neutropenic. So I wasn't able to completely function. I wasn't able to function at all, actually. And I would just be in bed, bedridden. And then I would have like 1 week a month pretty much that I would be able to go around the city, go to other doctor's appointments, like a physical therapist. I was working with a trainer. It was like 1 week a month that I could really live. I mean, I was really nauseous. I was dehydrated. I was fatigued. I definitely got sick regularly, but I was really able to hone in on what was working for me towards the end of my chemotherapy. Like I would eat food. I think one of the most important things for me being a petite woman was to gain weight rather than to lose weight. And so I would really try to nourish my body with pretty much like whatever I could get down and keep down. And so I would eat and then I would nap right after so I wouldn't get sick. Um, but I just remember being so fatigued, and just in pain too. I mean, the bone pain from Neulasta and some of these shots that happen after you do chemotherapy to help maintain a stable white blood cell count, they're so painful. The bone pain is excruciating. And I remember taking these baths at like 3 or 4 a.m. and just like filled with Epsom salt and just trying to soothe my body in any way that I could. Baths were a huge ritual for me that I really started to integrate into my routine and that I still do all the time today. But yeah, fatigued, nauseous, and that bone pain were really the main ones. Neupogen worked better for my body, and I think that's just bioindividuality is so real. Everybody is different, and so those were the two options that I had, Neulasta and Neupogen. But I feel like the Claritin really didn't do that much, if I'm being honest.
Yeah.
Things that worked for me, though, again, baths were huge. Like seaweed baths, Epsom salt baths. I used pure soma baths a lot just to ease body pain, and just help me relax. I really started to lean into a lot of spiritual modalities, and it was almost, I didn't go to therapy during treatment, but I worked with spiritual counselors and healers. And so I went to Reiki all the time, which not all the time, but in between every chemotherapy treatment, which was huge. I started to meditate regularly. I just I had to be a little bit more gentle with myself. And I was just I mean, as you go through treatment, more emotions start to unearth, and you start to go through, this roller coaster and this tumultuous health journey. So again, I remember going back a couple times for what was supposed to be my 6th chemotherapy treatment, and my counts were just not rising. I could not get my body back to a point where I could take another round of chemo. So we ended up deciding and landing on 5 chemotherapy sessions, getting a scan pre-surgery, and then moving forward with a tibial nerve removal, which I had multiple options there as well. Again, this is a decision that's unique to every single person and their age and where they live and what they do, but it really resonated most with me to take the middle of the road option, and move forward with tibial nerve removal. And again, that was a decision that I didn't take lightly, obviously, and I talked to multiple doctors and multiple surgeons. And in addition to my chemotherapy, the decision to stop early, I talked to multiple oncologists and multiple doctors to ensure that I was taking the right route and that felt best for me. But it was a really long surgery, really extensive. It was 8 hours, I believe. And I went in thinking that I was actually going to lose motor function of my left foot. So I was going to have drop foot. And this is something that, I was really mentally prepared for, and that I spoke about with my surgeon very frequently and with my friends and family often. And I had all these tools and these like wraps and things to help me recover already. And so I was mentally there. But after I got out of my surgery, I remember like waking up in my recovery bed, and I was able to move my foot instantly, which was like, I had a miracle surgery. They were able to save this motor function of my left foot because the tumor placement was actually like below. I mean, I'm not well versed in like a ton of medical lexicon, but the tumor was basically placed below where they needed to take out or something. And so essentially they couldn't see what they could see. They couldn't see anything in the scans. that would like really show that I was going to save my motor function. And so they were able to see it when they opened my leg up. But in brief, it was a miracle surgery. I mean, it was just like, my life could be completely different. You know, my doctors told me that I was like never going to do yoga again, or never going to run again, or, you know, do all these things that I am so blessed and so grateful to be able to do today. And like, it's crazy that like your life can change so much, and to realize that this can happen to anyone as well. And so I'm just so blessed with like my journey. And I think it's like, I really have to thank like not only my doctors, of course, and my nurses and my community, but I mean, I wholeheartedly believed that like I was in a miracle surgery. I remember like working with a Reiki healer and a spiritual, and I am very like woo and like spiritual. And she was like, you just have to believe in a miracle. And I was like so steadfast and like moving forward. And I was like, I will be fine. And I remember telling my doctors after, they were like, you know, you might not be able to run again or do yoga again. And I was like, you don't know me. And I think like, although people say so many things that can cause roadblocks in your mind, to always keep that positivity and that optimism, because like miracles can happen, as cheesy as that sounds. And I'm living proof of that. I mean, going through cancer did that for me. It provided a deeper perspective on life, and a deeper appreciation for just my body as this beautiful vehicle and this vessel of life. Whereas coming from the fashion industry, you get a little caught up in the facade and the material things. And when you're stripped down to just your core, you have nothing else to embrace but that.